Yes, my name is Rick Frank, and I'm a licensed occupational therapist in Massachusetts. I live in Boston, and I work for Spalding Rehabilitation Network in an outpatient clinic in just outside of Boston in Medford, Massachusetts. Most of my work is in a chronic pain rehab program, interdisciplinary program. So it's outpatient, and so I work closely with physical therapists and behavioral health practitioners, training people in self-management strategies so that they can live a more balanced and healthy life. So education, some of it is in the form of group treatment, and some individually. There's a whole spectrum of, they could be from traumatic injury, it could just be a progressive condition, or some medical issue. Could be people with orthopedic issues, back pain, neck pain, a lot of people with fibromyalgia, or chronic regional pain syndrome, and we definitely we're getting some people with Ehlers-Danlos syndrome, like joint hypermobility conditions, and also a functional neurological disorder. My job is part-time, and each of my days is a little bit different schedule, but we partly it's structured according to our group program, and yeah, it's a little different each day. I also do work in a therapeutic pool, so I would see some patients in the pool as part of that program. Oh. Yes, so our outpatient center has, for the most part, been closed, and we're seeing some people are getting treatment, but very, very few and far between. And most of the patients that I've been working with have either I've been following up, just doing check-ins on the phone, and sometimes actually doing treatments. We're just in the past week or two started doing telehealth visits. So either by phone or by video through Zoom. So I have my work computer at home, and I'm documenting in the medical record on my computer, and keeping track of my caseload. And we have not been adding new patients, but right now, because this is dragged on, kept going on, not knowing when it's going to end, we're working towards wrapping up with patients who really, don't really need that much more, and also in the process of starting to do initial evaluations with patients. So probably I'll be doing that some in the next week or two. And that's part of our usual population that gets referred to us, but that will be nearly all of it will be done from home. Okay, so I think what I've described is the outpatient piece, the change in the outpatient piece. So we're not seeing people in the clinic and doing all this from home, including treatments, even just like check-in follow-up calls, just saying, hi, how you doing? Are you okay? We're postponing until this certain dates. I'll answer any questions. Do you want to visit, or you just want me to check in with you occasionally? And then we have our meetings. But the other piece that I haven't described yet is that my clinic is part of a network, a whole system, a rehab system, and it's part of a larger healthcare system that includes acute care hospitals in the Boston area. So what they're seeing, from this bigger picture is that, we don't need to be staffing the outpatient centers, so they're redeploying us to inpatient facilities within the rehab network. So one site in particular, actually it's the site where people from my clinic are going, it has discharged most of their regular patients and is opening up beds, particularly for people who are recovering from COVID-19, being discharged from ICUs from the hospitals in our network, and are not in shape enough to go home. They have significant medical issues, or they're too weak and deconditioned and they need rehab. So staff from my clinic are doing a few different roles there. One was checking in staff as they come to work and verifying that they don't have symptoms. Just verbal, not doing any testing or anything like that. Some of them were preparing units, like actually cleaning out some floors in preparation for the COVID patients. I was trained to do therapy work, with this population. Well, it wasn't, the training was with their usual population, which was people with cancer getting chemo and radiation therapy, people who've had major organ transplants. So I had 3 days of training in this facility, with the idea that depending upon how things go, the surge in Boston, there may be a need for more people to work with people recovering from the virus. Mm-hmm. So there's the checking in role, there's the therapy role, and then there's also the nursing assistant role. So the idea is that they have the need. They need, just the nursing units have need on the floor for more manpower. So I was asked by my supervisor if how I would feel about doing, working with the COVID-19 patients as a therapist, and alternatively acting as a nurse's assistant. And I said, wherever you think is the greater need, I'll do where the need is. Mm-hmm. So they assigned me to the role of nursing assistant. So the hours that add up between my work in this hospital and the few hours that I'm still doing from home total up less than my total work hours, but I'm still getting paid my full salary. They have an emergency management fund they're allocating. And so up until the middle of May, I'm going to be getting my full regular salary. We don't know what's going to happen after May, whether I'm going to go back to the clinic or they're going to pay us differently. I don't really know. I've seen people who are really pretty much bedbound, mm-hmm. or even if they're getting up, they're very, very weak. But also, they're not allowed to leave their rooms. Mm-hmm. So if they're mobile, I'm not really seeing it. I mean, the therapists are going in and doing some work in the rooms, but they're trying to minimize how much people are going in and out of the rooms for my safety, to reduce the exposure, and also using up protective equipment. So being mindful of how much I'm going into and out of patient rooms. Small antidote to that is using electronic tablets, and they have them in a lot of the rooms. They can communicate with the people at the nursing staff, and I think they use them for communication with family. Mm-hmm. But they'll say, if someone needs help, they'll talk to them. You have the visual using that. And also, you know, for some of the patients, you could just like look in the room and talk to them. You know, it's not like they're walled off. You know, you just go in if they're not like laying in bed. You know, often you can easily talk to them. You know, there's, you know, whatever, 10, 20 feet away. Yeah, I mean, I'm not assigned to particular people. I mean, I have one nursing assistant that was directed to, but I'm learning to just like ask around anyone and say, can I help you with something? Or people just call out to me and say, hey, could you do this? Get this for me? So it's challenging to be in a new environment and be in a different role that I'm used to. And also, you know, I'm used to being, you know, trying to be very productive and manage my time and getting a lot of things done. And as is so far my experience, there's a lot of downtime, kind of like nothing to do, just waiting until someone needs something. That might be different next week. I don't really know.
Yeah.
It's all the, you know, the name of the game is often, you know, what are things going to be like? And the answer often is, we don't know, haven't decided, we're not cleared, depends upon how things go. That's a common answer to a lot of questions. I've been trained in the, you know, protective equipment and, you know, hygiene procedures about, you know, cleaning equipment and all that. Essentially, their needs are that they're deconditioned.
Yep.
And you know, it could be that they've got blood pressure issues, or they're getting enough oxygen. So they're monitoring their oxygen saturation. And you know, they're nothing. Just sort of general, typical, like people who've been in the hospital a long time. Well, I feel it's a good question. I feel that actually one factor that's about my work. I mean, I think that you know, I work with a really wonderful team of people. Both the team of people in my specific program, as well as the clinic in general. And so there's a nice camaraderie, and people are very supportive of each other, and we're doing things to stay connected. And the fact that our redeployment is all in the same place. So when I go to this hospital, I all the time run into people I know from the clinic where I work, and that is actually really helpful. It feels really good to be in this, you know, new environment and to see familiar faces. Yes, and I think there was some discussion at some point where it may have been going to different places, and there's clearly a decision made saying, oh, we think it might be a better idea to send you all, at least mostly, to the same facility. Social worker is going to start doing some meetings with us, you know, like sort of a, you know, support group once a week, and they set us up with a buddy system, so you have someone else that we can be in touch with by phone during the week. But on a personal level, other than, well, I feel like just going to the job, even, you know, even 1 or 2 days a week to this facility gives me some structure, and otherwise I'm pretty much home alone. I live alone. And it's really been helpful for me. I think that nearly every day I practice yoga, I meditate, and I go for a walk. And those are really great. And I've been like trying to be in touch with friends. I've been very into online board gaming and setting up. I set up a game night with friends tomorrow night that I'm hosting through Zoom. And I'm connected with, I'm in a psychotherapy, in a group psychotherapy that meets on Zoom, and I'm in another retreat organization that has events, and another small group that we meet. So I've had like lots of stuff on my schedule. I think the name of the game is taking care of oneself, trying to live as balanced a day as possible, reaching out for supports to work colleagues, networking, professional, emotional supports, and doing fun things online, getting together and playing with people, doing all sorts of fun virtual things that can be done, dancing and singing and game, so like try it's hard, but being part of a community, even in isolation,
Mm-hmm.
is really important.